Hi, it's Mark Laurrie. It's Thursday, September 24th. I hope you continue to find our YouTube video updates helpful. Today we have quite a bit of information, so let's go, as we like to say. Look, at all of our requests for MiFi and virtual learning have ended. We have to call a halt to this. It's very difficult to schedule. It's very difficult to manage, and people have had plenty of time to make these decisions. So I do get an occasional request. I do need to stop that. Please don't call the office or the school. In order to do that access, we need to lock in schedules now. Because what I'm going to tell the students and parents that next week we're going to up our remote learning expectations. We're going to start following a very regular, rigid schedule during the day when students are going to be responsible for checking in quite frequently. So students, you shouldn't be working during the school day. It's against labor laws. You should be ready between 8 and 3 if you're hybrid or remote, especially remote learners, to log on and get work done. Next, let's talk about our friends at the Niagara County Department of Health, our nurse practitioner, Dr. Civaroli, and our district. Next Wednesday, September 30th, and Thursday, October 1st, we will offer through the county rapid COVID-19 testing to any staff member who would like it. You need to call 286-0788, 286-0788. You must schedule an appointment. Please allow for 15 minutes after your test so it can be read. You will be taken aside if there is a need to. These are free Department of Health tests. You should look at your schedule of work. Any staff member, teacher, administrator, non-instructional. Call for an appointment if you wish. I'll have the schedule. I will clear it with your administrators. This is an important thing. Thank you to our Department of Health for doing that. I talked about technology. Next Wednesday will be our final mass distribution of technology. That's laptops and MiFis. Hybrid students, you're going to start to be able to take your technology home with a signed permission slip, all your logon credentials cached. The only issue I'm asking you to be very careful with is that we're still on a little bit of a back order for carrying sleeves. Please treat these $600 devices with great care, like you would any piece of expensive equipment. But we feel as a district they're necessary to do the function of learning and teaching. I'm pleased to report that we have no COVID cases in the district. We are doing everything we can to keep social distancing and face covering and all the good things that are happening. If there is a case, I would inform that class in that school. What I need you to know is that we do frequently have, not frequently, but from time to time, we have isolation room visits. As of this recording, we've had 2 today. We want you to be aware that if you have any symptoms, coughing, diarrhea, vomiting, sore throat, temperature, parents should be taking temperatures in the morning, headache, those will be reasons to go to the isolation room. When you're sent there, your parent, your guardian need to get you a negative COVID test. We'll need to get a doctor's note for you to return that says you're symptom-free without medication, and then we'll welcome you back. In the meantime, if you do that, we need to have you and your siblings taken to a bit of a quarantine. We're not trying to be difficult about this. We're just trying to be overly precautious. MAP testing, the last day I read this, but because I think we've articulated this over the last 3 days, the measures of acceptable progress through the NWEA will be administered to both in-school hybrid students and remote students. That's coming up in October. It'll give us a chance to see where you're performing academically. It'll help teachers devise individual lesson plans. It's not for your report card, your grade book, anything like that. It's just to get teachers some help in seeing where you are, because quite frankly, we've been away from assessment for over 7 months. I'm looking at my notes. I'm feeling good about everything, but the fact that I didn't tell you that if you do not have an up-to-date immunization record, New York State requires immunization records. And it doesn't matter if you're virtual or in-person hybrid. Your record must be up to date. New York State tells us that we have to exclude you as of September 28th. You at least must need to have your appointment card to present to our nurses and nurse practitioner. Get that done. I'll repeat that every day until the 28th. Finally, a special feature for you today, as our technology is being distributed at a much quicker rate and as we up our expectation for learning and teaching, we have put together a student parent technology help desk request form. How do I get to that? It will go live this evening. If you're having school-based technology issues, you'll click on our website, which is www.nfschools.net. You'll go to the Student Resources channel. You'll click on the left frame where it says Student Technology Help. You'll enter your information, and a district representative will text, call, or email you the resolution to your problem. Please, we'll talk about that more in the future, but we do have a student help desk for those software or hardware issues. We're trying to think of everything. We know it's slow. We thank you for your progress. We appreciate your support, and we are just so proud of the work you've done in Niagara Falls. Keep those face coverings on. You've been perfect. Another gold day tomorrow. Distancing socially, 6 feet or more. Masks all the time or face coverings. Hand washing, sanitizer, soap and water. Positive attitude is the stress for today. Thank you so much. Have a great day.